Updated federal data tonight shows that there have been more than 25,000 cases of whooping cough in the United States so far this year. It is the second year in a row with a higher than usual case number. That is according to the CDC. So here to answer some of those questions, as you can see, is Dr. Todd Ellerin from South Shore Health. It's great to see you. Happy Tuesday before Thanksgiving.
Happy Thanksgiving.
I can't believe we're talking about whooping cough. I never thought we would, but what is whooping cough and how is it spread?
Right, it's a bacterial infection. It's called Bordetella, and it's vaccine preventable. People refer to it as the 100-day cough. I want you to think about that. People can have coughing for over 3 months. It can be relentless. It can be violent. It can cause kids or adults to actually vomit after. That can be a clue to it. And it's just, it can, the coughing is so severe that it can be so fatiguing and weak that it can really just break up families. Because it's so difficult to deal with. People can't sleep with it.
Yeah. Just think of the length of that, too. 100 days is a season. Winter, spring, summer, about 100 days, essentially.
Right.
Wow. So infected people can be contagious for what? Weeks without even know that they have it, right?
It's true, and I think that's really underscores the importance of getting vaccinated. The vaccine works, it's effective. Who's most at risk for pertussis is kids under 1 year of age. So it's really the infants and children, but if you can get vaccinated in these kids are supposed to start getting vaccinated at 2 months, but the other people are adults. We're supposed to get a booster every 10 years for pertussis. It comes not as one vaccine, but as part of tetanus and diphtheria.
Yeah.
The other group is pregnant women. Every pregnancy during the 3rd trimester is supposed to get that pertussis shot, and that protects the baby that's vulnerable.
So with families getting together for Thanksgiving this week and the surge in case numbers, do people need to worry?
I don't think people really have to worry so much, especially if you're up to date with your vaccines.
Gotcha.
I think that's the key. Listen, there were 25,000 cases cases this year, 35,000 last year. It's a big number, but I think the key is it is preventable.
If you think you have whooping cough, when should you seek medical care?
That's the interesting part of this, because whooping cough starts off as just like the common cold.
Right. You don't think anything about it.
You don't think about it, and that's when treatment is the most beneficial with just regular antibiotics. But people don't think about it at that point. So you're really coming in after 2 or 3 weeks. By that time, the antibiotics aren't as helpful to change the course. So it's a tough one. That's why the vaccine's important.
Dr. Ellerin, great to see you. Are you hosting or are you traveling on Thanksgiving?
I'm traveling.
You're traveling?
Yep. Traveling to Connecticut.
Maria, that's why he has a smile on his face.
I know.